SABCS is the biggest gathering for breast cancer research anywhere in the world. People fly in from all over to hear about cutting edge advances, to understand how to incorporate those into the care they provide to our patients, and dream up the next big research studies that are going to take us even further towards our goals of ridding the world of the fear of breast cancer.
Welcome to Breast Cancer Breakthroughs. You just heard Komen scholar Dr. Reshma Jagsi describe the significance of the San Antonio Breast Cancer Symposium, also known as SABCS. Held for the 48th year in December of 2025, this symposium brought together clinicians, patients, advocates, and researchers, all to share the latest discoveries and discuss the future of breast cancer care. In this episode of Breast Cancer Breakthroughs, Dr. Jagsi will be joined by Komen Scientific Advisory Board member Dr. Ben-Ho Park, Komen scholar Dr. Susan Domchek, and Komen Advocate in Science Jane Perlmutter as they discuss some of what was presented at SABCS and why it matters for people impacted by breast cancer. First, let's talk about the SABCS McGuire Award. It is presented every year to individuals who have made outstanding contributions to breast cancer research. This year, it was presented to former Komen grantee Dr. Armando Giuliano, whose work contributed to drastic changes in the surgical management of breast cancer. Dr. Jagsi discussed how this transformative work has reduced the physical burden of breast cancer treatment.
So, as a radiation oncologist, my role in the multidisciplinary care of patients with cancer focuses largely on the management of disease in the breast itself and the surrounding regional lymph node basins. And so, the management of the axilla, which is a fancy word for the armpit, but that is an area where lymph nodes are, where breast cancer can spread, has changed a lot over the years. For many years, the standard of care was something called a complete level 1 and 2 axillary lymph node dissection. And this was an extremely invasive surgical procedure that had high rates of side effects like lymphedema, swelling of the arm that compromised function, the ability to perform work-related tasks. This was really not only very symptomatically unpleasant, but also limiting in the things that mean the most to us as human beings to be able to do. And think about how much we use our hands. And so there has been so much progress over time towards de-escalating that procedure. First, towards something known as a sentinel lymph node biopsy, where we look at just one or a few lymph nodes that are most likely to be the first ones to which breast cancer would spread, and see if they're not affected, feel reassured that we don't need to do anything further in terms of escalating treatment or dissecting that axilla. And then over time, we've even found that there are some patients who do have some spread to that initial sentinel lymph node who might still be candidates for other treatments that don't involve more surgery or that might be more tolerable to the patient. And now there's interest in whether all patients even require surgical assessment of their lymph nodes. So there's really been this shift over time, and that has really opened up options. And we're still learning more. We want to do this safely. We don't want to forego a treatment or an assessment that informs treatment that might compromise, interfere with disease control. But on the other hand, we want to make sure that what we're doing is really necessary, because everything we do has consequences for the patients that are receiving these treatments.
One example of a clinical trial examining the need of axilla surgery is the INSEMA trial. This trial examines if less axillary surgery is best in early stage, limited node-positive breast cancer. INSEMA results presented at SABCS show that those receiving either a sentinel lymph node biopsy or an axillary lymph node dissection, which is the removal of the lymph nodes in the armpit, had similar rates of disease recurrence and overall survival after 5 years. These data suggest that some individuals with early-stage breast cancer may safely avoid axillary lymph node dissection and its complications, which is a concept known as treatment de-escalation. If you'd like to learn more about treatment de-escalation, check out our video linked below. Delivering effective treatments while maintaining patient quality of life was a central theme of this year's SABCS, in part because of the patient advocates, who are individuals that offer the patient perspective at every step along the way in the research process. Patient advocates play a vital role in the symposium and in the field of breast cancer research and care. We spoke with Jane Perlmutter, who was diagnosed with her first breast cancer in 1985 and has been involved in advocacy ever since. Jane discussed the involvement of patient advocates at this year's SABCS. She spoke at the Alamo Advocate Program, which celebrated its 25th year and reflected on the growth of patient advocate involvement in breast cancer research.
I am part of the Advocate Program this year, so I'm mentoring some advocates, including international advocates, which is really exciting. The Alamo program is for advocates, and that was how I first got here, probably more than 20 years ago. And this year, they invited me to mentor people. I also was a panelist, one of the panelists on one of the sessions, and it was really terrific to see that advocates were on every single session. And I expect that more and more conferences are going to be doing that, and that the advocates will probably be kept playing a bigger and bigger role. Some of the advocates and some of the sessions, the advocates had a really significant impact. And research advocacy has really evolved over the years that I've been involved. It started out almost sort of grudgingly, we'll try it, and then it was sort of some tokenism, and then some forward-looking researchers engaged advocates in their work. And now, especially with a new generation, people are proactively recognizing that involving advocates early and often is just making a huge difference.
Jane was honored with the Komen Research Advocacy Champion Award at SABCS, which you can read about in our blog linked below. If you want to learn more about how to get involved in Komen's patient advocacy work, you can check out the information we've linked in the description. We next spoke with Dr. Ben-Ho Park, who discussed liquid biopsy, an area of research that has gained a lot of interest in the patient community and was a hot topic at SABCS. Dr. Park talked about the immense potential of liquid biopsy and its impact on patients.
So the question of what is ctDNA, sometimes colloquially referred to as liquid biopsies. Well, so we have known literally for decades that all of our cells in our body, including cancer cells, if there is cancer present there, will shed naked free-floating DNA into the circulation. We don't think this has a function, at least I don't. Most people think it's a waste product. We have known about this for decades, but we never had good enough technologies to really isolate it and analyze it. And in particular, when we're thinking about cancer DNA, so cancer DNA is basically called circulating tumor DNA that's in the cell-free DNA space. Remember, every cell sheds this naked free-flowing DNA. And so cell-free DNA is the whole gamish. Circulating tumor DNA is the subfraction that comes from cancer cells. Now, we all know cancer is a disease of DNA mistakes like mutations and other alterations. The ability to isolate and distinguish just the cancer DNA, the ctDNA, from the rest of the cell-free DNA was always the technical challenge. So way back when at Johns Hopkins, my former mentor, Bert Vogelstein, really created the first technologies that allowed us to pluck the needles out of the haystack, is how we kind of describe it. And that really opened up the doors for next-gen sequencing and other ways that we could actually get low levels or low amounts of ctDNA analyzed and actually use them for clinical purposes. And the first current use, which is the current use right now for many cancers, is in metastatic disease, where we had all these drugs coming down the pipeline that had molecular alterations as their target. So we call those companion diagnostics. And you have to actually have a specific mutation, let's say in a gene, to get a specific drug. Makes perfect sense. Getting a tissue biopsy sometimes isn't possible, and sometimes isn't as accurate as getting cell-free DNA that has ctDNA in it. Now that we have those technologies, this is routinely used in clinical practice for metastatic patients. The next iteration of how we're going to use ctDNA, in my view, is going to be the quantitative aspects. So it's not just, hey, can we find a mutation that has a drug for it? It's, can we measure accurately how much disease a patient has?
We are excited to see how this new technology is poised to transform breast cancer care. If you want to learn more about ctDNA and liquid biopsy, you can check out our video linked below. We've also linked to additional resources on this topic in the description. Next, Dr. Park talked about the HER2CLIMB-05 trial, which was presented at SABCS. This clinical trial is testing if tucatinib, a small inhibitor of HER2, improves outcomes when used in combination with standard of care trastuzumab and pertuzumab as maintenance therapy for individuals with metastatic HER2-positive breast cancer.
HER2CLIMB-05. This is a study looking at whether or not adding a drug called tucatinib, which can penetrate the blood-brain barrier, and the hypothesis would be that this would lead to less recurrences in the brain compared to the current standard of giving antibody therapies. And that makes a lot of sense because we know that antibody therapies can work in established metastatic disease because in tumors, the blood vessels tend to be more porous, for lack of a better term. But when patients don't have that, many of the times the antibodies just can't get in there because of the blood-brain barrier. But this small molecule, tucatinib, was really one of the first, if not the first, to demonstrate for patients who had active brain metastasis, this could actually lead to improved outcomes. So I think we're excited that this would actually set a new standard of care in the future.
HER2CLIMB-05 results presented at SABCS showed that individuals that received tucatinib had no progression of disease for 8.6 months longer than those who did not receive tucatinib. The addition of tucatinib also prolonged the time where participants could remain off of chemotherapy. In addition to HER2CLIMB-05, the LidERA Trial results were presented. This trial is testing the use of a novel oral SERD called giredestrant as adjuvant treatment for patients with early-stage estrogen receptor-positive, HER2-negative breast cancer, and this is compared to the standard of care endocrine therapy. Results from LidERA showed that after about 2.5 years, patients receiving giredestrant were 30% less likely to develop invasive disease regression than those receiving standard of care. This means that 3 out of 10 patients receiving giredestrant were less likely to have their cancer spread from the breast into surrounding tissues or other parts of the body. Early analysis also shows a trend towards improved overall survival with giredestrant, although longer follow-up is needed. We will keep you updated on the future results for both HER2CLIMB-05 and LidERA. With advancements in artificial intelligence, the medical field is examining ways to use this expanding technology to benefit patients. Presented at SABCS was the TAILORx AI Analysis. The goal of this study was to use artificial intelligence to develop a diagnostic test called multimodal AI to better determine the distant recurrence risk using patient data collected from the TAILORx study. The Oncotype DX21 gene recurrence score is what we currently use in the clinic, but it does not accurately predict breast cancer recurrence after 5 years. These results showed that the AI model was able to outperform the Oncotype DX in predicting late breast cancer recurrence. We look forward to seeing how AI can be used to improve breast cancer care and patient outcomes in the future. We also spoke with Dr. Susan Domchek, who talked about how genetics impact breast cancer risk and how we can improve early detection of breast cancer and improve outcomes for those individuals who are at a higher risk of developing breast cancer. Specifically, she referenced the Wisdom study.
There's a really important readout of a study led by Laura Esserman called the Wisdom Trial, which is evaluating how we can use information about genetics and things called polygenic risk scores to stratify people into the right breast cancer screening. We already know that establishing if someone has a genetic susceptibility to cancer can be really useful therapeutically. So we know for early stage high risk breast cancer for BRCA1 and 2 mutation carriers, we use specific drugs to help improve outcomes. We also know that if you understand that someone's at risk for developing cancer, you can provide enhanced screening, you can have risk reduction options. And so in this study, people who are not necessarily known to be at risk underwent screening, and including these things called polygenic risk scores, which are likely more applicable in the general population. So it's going to be really important to see how we're going to use this information, and again, most importantly, how it benefits patients.
While the Wisdom study is ongoing, initial results presented at SABCS support risk-based screening that could improve breast cancer detection. We will keep you posted on future results from this study. SABCS is a 4-day conference packed with new information for the breast cancer community. Patients may find it difficult to know what information is the most applicable for their own health. If you have questions about any of the results presented at SABCS and how it may apply to your care, please discuss them with your doctor. Thank you all so much for watching. We hope that you are also as excited as we are about the news coming out of the San Antonio Breast Cancer Symposium. If you'd like to learn more about the Komen-led research that was spotlighted at SABCS, which we didn't even cover in this episode, you can check out the blog we linked below. Don't forget to sign up for reminders for breast cancer breakthroughs. We can link the homepage below. And be sure to like and subscribe to this channel to catch more episodes. And finally, if you enjoyed today's episode, please take 2 minutes to fill out our short survey, which we've linked in the description.